100 million Americans are now either pre-diabetic or diabetic. One doctor here in town is not only helping those dealing with diabetes, but also obesity, hypertension, and high cholesterol.
Dr. Dietmar Gahn and certified nutrition consultant Elizabeth Gahn join us to talk about Diet of Hope. Thank you both so much for joining us.
Oh, thank you for being here. We're glad to be here.
Absolutely. And Doctor, we were kind of listing off the different patients that you guys handle at your clinic. What is kind of your success rate with these different types of patients?
Well, we started our program 4 years ago when I retired from my cardiology practice. And my wife insisted you have to do something in retirement. And her contribution was, you know, we want to start something we are interested in. So she became a nutritionist, and we started our program, the Diet of Hope. And within this 4 years, we have now have seen 5,000 people. Those 5,000 people, most of them were very successful. We have a phase 1 program that goes for 6 weeks. Patients are seen every week for 6 weeks. And in those 6 weeks, they're expected to lose from 5 to 15% of body weight.
Wow.
So if you weigh 200 pounds, you can lose 20 pounds. Now, of course, the question is always, yeah, there are many programs out there. You can lose weight fairly quickly, but then what?
Right.
So we have long-term data now, at least for 1 year. And in that 1 year data, 72% people who finish our phase 1 continue to lose weight or at least maintain their weight. And we have a star patient, Linda, and we just quickly saw her picture there.
We were looking at her amazing transformation.
She has lost 235 pounds.
Wow.
In a period of 2.5 years. And she has regained her health. We know of at least 30 patients who have lost over 100 pounds. We have hundreds of patients who lost more than 50 pounds. So we're very successful in that. Obviously, weight is one problem, but with the weight loss comes your health. Your blood sugar goes down, your blood pressure goes down, your cholesterol goes down. People with arthritis do much better. If you have gastric reflux, all those things improve. So, and people realize this is not just a dietary program. This is really changing lifestyle. And it's a lifelong commitment. And many people have realized that's what we are for.
Yeah.
So what is the Diet of Hope, and how do you work together with your wife, and work with the nutrition of it, as well as getting their health back in check to help things like you said, arthritis, to help diabetes and everything like that?
Well, one of the big things, is that we all understand that there's no quick fix. A lot of people are touting out there that surgery is going to change things, but we have, Dr. Gahn has been in cardiology for over 30 years. And my mother passed away with complications from diabetes. So together we decided we need to do something. And we have found that through nutrition, teaching people how to change their lives. And that's very important. There is no quick fix. So people have got to understand it is a life change. And that's what we teach them in our program. And we have been very successful.
And I know you were touching a little bit on diabetes as something personal with you. Do these two things kind of go hand in hand when you're talking about the weight loss and if somebody is dealing with diabetes?
Oh, absolutely. Dr. Gahn always speaks to the fact that, diabetes is in our genes, and definitely in my genes, because all my family are diabetics. But those genes get activated with what we eat. And we have found that to be very, very true. In fact, I believe, patients going through our program who are diabetics on insulin are able to go off the insulin or reduce their medications. So it definitely has to do with what we're eating. That's what activates the diabetic genes.
And you touched a little bit on surgery. Does this Diet of Hope Institute, do you condone surgery, or is that okay along with a diet, or what do you suggest?
Well, again, answer that both. But the surgery is not the answer. We see that, yes, they lose weight quickly, But their data are now, after 2 years, people with a lap band, they 60% gain their weight back, 60%. And even the ones who had bypass, gastric bypass, 40% after 2 years gain their weight back. And you can give the
And probably part of that is because they never learned how to eat the right way. And as you saw Linda's picture, without any surgery, without any medications, she has been able to lose 235 pounds by changing her lifestyle. And we now have actually over 50 patients that have gone through our program who have had these surgeries. And they're now coming to us because they never learned how to change their life, how to eat correctly, so they started gaining their weight back. So now they're going through our program. So again, surgery is a last resort, and there's no quick fix. I keep saying that, but
Yeah.
you know, that is so true. We have to work at it and change our lives.
It is. This is not a quick fix. What you guys are giving to these people is a lifestyle change.
Correct.
And that's what really you want to give out there. Now, of course, if you're interested in Dr. Gahn's Diet of Hope, you can attend their free monthly seminar on October 15th at the Pima Medical Society, located at 5199 East Farnes Drive. Check-in is at 5:30 p.m. and the event begins at 6. For more information, you can call 696-DIET. That's 696-3438. And log on to their website, dietofhope.org. Thank you both so much for joining us today.
Thank you.